Well, why don't we go ahead and,
Okay.
welcome to you guys, Abby and Leslie. I guess you are here as well.
Yes, I am.
Yes. We
So,
she
so why don't you both introduce yourselves briefly and tell us just, the 30-second bit about AgeGuide, and then, we'll turn it over to you.
Okay. Um, I'll start. We have a little slide about AgeGuide, so if you, we'll save that for a second if you don't mind. I'm
Sure.
Leslie Edstrom. I'm the deputy director at AgeGuide. I've been working at the AgeGuide for 8 years, but prior to that, I worked at Senior Services Associates, and I was there for 15 years. So I've been in the Aging and Disability Resource Network area for many, many years, and I'm really happy to be here tonight. I'll turn it over to Abby.
Hi, yes, I'm Abby Bombach Davy. I'm the caregiver and dementia specialist with AgeGuide. I've been with AgeGuide only about 4 months now. But prior to working with AgeGuide, I worked also for senior services. Leslie and I's paths never crossed at senior services, but I was there for about 2.5 years as their caregiver support specialist. So familiar with caregivers, familiar with working with caregivers and finding resources. So also happy to be here tonight.
Well, welcome. So tell us about AgeGuide.
Okay, maybe we should move to the next slide. Okay, thank you. So AgeGuide is an area agency on aging, and I'll just start by saying what area agencies on aging do is we receive federal funding for Older Americans Act services, and I'll talk to you a little bit more about that in a second. And we also receive state funding from the Illinois Department on Aging. We have our planning and service area includes DuPage, Grundy, Kane, Kankakee, Kendall, Lake, McHenry, and Will counties. Now I know that AID's service area is in about all of those counties except Lake, Grundy, and Kankakee counties. So we are your area agency if you live in those counties. And what we do is we take all that funding that we get from the federal government and from the state, and we push it out into the 8 counties. And services like Abby and I were talking about, we worked prior to this at Senior Services Associates. So they have offices in Kane, Kendall, and McHenry County. So they then are the direct service providers of many of the services that we're going to be talking about today in those counties. And when we get closer to the end of the presentation, we will be sharing their contact information and how you could reach all these different aging and disability resource networks and the caregiver specialists. So you'll have all the resources and contact information for that you might need. So area agencies on aging are in every state. There are 13 area agencies in the state of Illinois. But if you had a friend or a relative that lived in another state and they were looking for resources and you knew about AgeGuide, you could still have them call AgeGuide and we would be able to tell them who their area agency is in Philadelphia or something like that, because we're all connected and we're willing and able to help people, just at least point them in the right direction if they're from another state. But even in our counties, if you were from Cook County, we would refer you to the area agency. That's our sister agency, Age Options in Cook County. Okay, so because these are federally funded programs, there are no income requirements. There are programs that the state of Illinois runs, like the Community Care Program, which is a waiver program, that there are income and asset requirements. So I just like to say that because sometimes people get confused because there are state programs that have those requirements, but none of the Older American Act services that I'm going to speak about today have income or asset requirements, and no one is denied services if they choose not to donate. So our staff that are working in the community are required to ask for a donation, but if somebody's just not willing or able to donate, they get the services anyway. So I want to make that very clear as well. Okay, so we're ready to go to the next slide, please. Okay, so we fund home and community-based services like elder rights. That includes services like the Ombudsman program that helps older adults that are living in long-term care to make sure their needs and rights are met. We also have adult protective services that we work with people that are in the community that are suffering from anything from um, financial exploitation to physical abuse to self-neglect, for example. And we also have legal services that are available through this elder rights area. Then we have supportive services, which I was just speaking about, the Aging and Disability Resource Network services. I'm going to get into that in a little bit more detail. That's one of those supportive services. A couple others would be transportation, friendly visiting programs, a couple examples there. Then we have health and wellness programs. These are programs like recreation, evidence-based programs like falls prevention classes, matter of balance, bingo size are a couple of examples of those services. Then we have nutrition services, and I'm sure many of you have heard of home delivered meals. That's a nutrition service that is out there and that Older Americans Act funding supports, as well as the state. And then we also have community dining. There are many sites throughout our region that offer meals for people to come together. They come for the food and stay for the fun is the big thing that everybody says, and it really is. It becomes like a community of friends through those community dining experiences. And then finally, and most importantly, for this crowd, we have caregiver services, and Abby's going to be talking about that in just a minute. But before I turn it over to her, I'd like to spend a minute of your time talking about the Aging and Disability Network services. I want you to think about these services as the gateway to everything. Sometimes people say, if I only knew that these services existed, I would have tried to get these services when I was, years ago. Well, when you call an Aging and Disability Resource Network, they're going to ask you, you're going to tell them what you need, like if you're looking for housing options. And in the course of the conversation with that person, you're going to discover that there might be a few other things that you're looking for. And the Aging and Disability Resource Network can provide the information and connect you to the services you need. Some of the things we do, you see here on the screen, is information and assistance. So again, connecting people to Older Americans Act programs, benefits access, ensuring that you get all of the benefits that you're required to receive, Medicare counseling and benefit access. This is non-biased, unbiased assistance. Sometimes you see on TV these different places are wanting you to call them and they can talk to you about Medicare Advantage plans. You get Medicare counseling and benefits access. That is going to give you the best plan for the situation that you're in. And there's no financial gains for anybody giving you the information that you need. And then there's also options counseling. This is more in-depth information assistance. So somebody may say, I'm looking for housing options. I want to sell my home and move into a place that's maybe better for my retirement. Maybe it's one floor or whatever. Well, instead of just handing you a list and saying, okay, well, here's some places in your area, the options counseling would say, here's a list of some places in your area. And if you'd like to call me back after you take a look at them, and we can talk through a few of them that you're interested in. So they go into greater detail with you. So some people choose that. They want more support when they're looking at options. And so that's what options counseling does. And then finally, there's flexible community services. This is financial assistance for items such as food, rent, mortgage, minor home repairs. And it's really to keep people in their homes and safe and to help with their well-being. So we know sometimes we hear of somebody who had an unanticipated situation that happened with their car, and that it's broken down and they need to have it fixed. And the money that it takes to get that fixed is now money that can't go to pay their rent or can't go to pay their utilities, and they just don't have any savings behind them. So flexible community services can help people who are in that kind of bind to cover that cost for them for that month where they're in a serious situation, and can also perhaps help them find some additional resources. Again, benefits access sometimes can show them where there's some benefits that they can receive that help them with their financial needs. So that's Aging and Disability Resource Network services. And at this time, I'd like to turn it over to Abby to talk about caregiver services. Abby?
Awesome. Thank you, Leslie. So again, I'm Abby, AgeGuide's caregiver and dementia specialist. I help oversee the 3E caregiver support programs in our 8-county region. So those would be the 3E programs under the Older Americans Act. So to start, we just want to give some definitions of caregivers. For program eligibility purposes, a caregiver is defined as an informal caregiver aged 18 or older, providing care to someone 60 or older, or people of any age with Alzheimer's disease or other form of dementia. A caregiver can also be a non-parent relative age 55 or older who provides care to children under 18. You'll often hear this population referred to as grandparents raising grandchildren, relatives raising children, or kinship families. And then a caregiver can also be an older relative, including a parent who is age 55 or older, providing care to a person with a disability aged 18 to 59. Again, that's another definition of caregiver for this program. And then we also have a grant funding source that is specifically available to support relatives who are under the age of 55, providing care to a child or to an adult with a disability in place of their biological parent. I want to note that when we talk about non-parent relatives, there must be a legal relationship present in order to receive services such as legal custody or guardianship of the individual. However, in the absence of a legal relationship, adequate evidence or proof is needed to show that the individual or the caregiver is the sole primary caregiver of the person with the disability or the child. And then we do have funding that can specifically be used to help obtain that legal relationship if that's what someone needs. Right, and then this is just a quick slide to show that under the caregiver services branch, we have family and informal caregivers. Those are what we typically think of as like caregivers to older adults, caregivers to people with dementia. And then we have kinship relatives, which would be the non-parent relatives or parent relatives over the age of 55 taking care of a child with a disability. Okay, so for services for relatives over 55, there's a variety of services. In a few slides, I'll go over the resources specifically for non-parent caregivers under 55, but I want to start talking about case management, which offers navigation of local resources and access to services provided to caregivers under Title 3E of the Older Americans Act. Through case management, we also offer a caregiver assessment tool called TCare. I'll talk about that in the next slide. We also offer respite services, which can help pay for day services or in-home care to help give the relatives a break from caregiving. I want to note that it's not a permanent solution to care. It's designed to be a temporary break. Some use respite for assistance with home care when a caregiver is going to have surgery and they might need some extra support for their loved one during their recovery time. Others will use it to help pay for adult day services at a community center, say for one day a week over the course of a few months. Like if there's a certain class that's being offered every Tuesday afternoon, we could set aside some respite to pay for day services so that that caregiver could go to that class every Tuesday afternoon for 8 weeks or whatever it may be. We also have gap filling services, which can help pay for adaptive devices and other necessary supplies to support the caregiver. Examples would be like a wheelchair or a scooter ramp, grab bars, other household aids that aren't being covered by insurance. And then it can also be used along with the FCS funds that Leslie had talked about. It can also be used as a one-time emergency assistance with rent, utilities, or groceries, just depending on the situation. We offer legal assistance. Like I had mentioned, we have a partnership with Prairie State Legal Services specifically to support caregivers with things like guardianship, advanced directives, other legal needs for kinship relatives. We also offer caregiver counseling in each of our 8 counties. individual counseling and support group counseling. And these services, the counseling services, are completely free. It's really for anyone who needs a space to talk about their caregiving and receive just some additional support in what they're doing. And then lastly, we offer training and education. This is offered in a couple different ways. Our funded partners host training and education sessions at their locations throughout the counties, like Leslie had talked about, different community locations. And then we also offer a free caregiver education platform called True, and I'll talk a little bit more about that in a couple slides. Okay, so I just want to spend a minute on TCARE. TCARE assessments are offered under our case management program. TCARE stands for Tailored Caregiver Assessment and Referral. It's an evidence-based assessment tool that identifies the stressors of individual caregivers and provides personalized tools and resources to support them in their caregiving. The assessment allows the case manager to just gather a better idea of the kind of care that someone's providing and how a caregiver is doing. And then from there, the case manager is able to see what kind of services exist in the community that could help support you. This could be internal programs that they offer, like the ones under our Older American Act programs. It could also be other community resources that they might have connections with, like Habitat for Humanity or like the rebuilding projects that are present in some of the communities. The goal, though, of TCARE is to prevent burnout in caregivers and just ensure that they feel supported and that the caregivers specifically are getting connected to the resources that could support them. I had mentioned True, which is one of our forms of training and education that we offer to caregivers. It's an online learning and support platform. Caregivers can virtually access training, resources, live events, community, and connections. I kind of like to refer to True as like a Google for caregivers. Within their website, you can search for whatever it is that you're needing more information on, and then it'll show you the articles, videos, worksheets, and even webinars that are related to the specific thing that you're trying to get some more information on. And then I always like to mention that they have this emergency planning workbook, which it's downloadable, printable, and it sounds long, but it's a 28-page document that could be filled out with really any information that someone would need to know if something happened to the caregiver and somebody else had to step in and take place as being the caregiver to your loved one. It goes as far deep as like, where can someone find social security cards? Where can we find our insurance cards? Is there a will put in place? But then it also talks about like daily routines and schedules, things that someone likes or doesn't like, so that it's really all mapped out for someone. Like if you use True for anything, I just really hope people will use that workbook. But True also helps build a sense of community through caregiver support groups that are available every day of the week. And then they also offer online chat forums where caregivers can ask questions and get feedback from those in similar situations. These
Abby,
resources, yeah.
and this is, if I just Google Trualta, all of these resources, like all of the print resources and the emergency planning workbook, those are just freely available?
So on the next slide, I'll have a QR code that could be scanned, and then you guys would be able to make an account. And
Okay.
that's something that I want to highlight here is that if you are a caregiver within our 8-county region, True is free, completely free for any caregivers in our region. If you're outside of our region, your AAA might have a partnership with True already. And then if they don't, Molina Health Insurance does partner with True. So if you have Molina Health Insurance, you would have access to True as well.
Can I just interrupt you for 1 second there?
Of course,
If
yeah.
you go right to our website right now, at the bottom of the homepage, it says True. Do you want access to True's caregiver learning platform? And then you sign up. And so if you don't want to use this, some people don't like to use the QR code. It's right. You can't miss it on our homepage. for AgeGuide. It's literally at the bottom of the page. You don't have to scroll down or anything. So I just wanted to let you know that.
Thank
We
you.
can even include the link in the slides that we end up sending you guys so that the active link is there too.
That would be great. Thank you.
And then I just wanted to highlight a couple of the toolkits that Trolta has put together specifically for caregivers of those with IDD. There's a IDD Daily Care Toolkit, which is composed of 18 different educational activities. So like different articles, different webinars, videos. And then this one focuses on how to create stable routines and stick to them, make sustainable changes to routines, and strategies to adjust challenges like dressing, showering, skin care, oral care, sleep, and taking medications. And then the other toolkit that I wanted to highlight was IDD and Building Wellness. This toolkit has 14 different educational activities. And with this series, you would learn more about mental health challenges, trauma, social isolation, and challenging behaviors. And then it helps to build skills on how you as a caregiver can help support self-esteem, resilience, and social skills. And then you'll also learn about providing person-centered care and using some strategies for planning for the future. Okay, so this is that separate grant fund that I was talking about that is in place for relative caregivers who are under the age of 55, who are either raising children or supporting adults with disabilities. And this is called the ILGRG grant, but it's open to any relative caregivers under 55 who have stepped in to help provide care in place of a biological parent. So this would include relatives under 55 who have stepped in to help support an individual with disability, age 18 to 59. And we might see this in a sibling who has stepped in to help take care of their adult sibling with a disability after their parents may have passed away, or if their parents are no longer able to be that primary caregiver. Anyone over 55 would utilize that kinship support program that I talked about in like the last 4 slides. But the under 55, this is what this program is for. And then this is a smaller state-funded grant that's geared towards our younger caregivers. This program provides one-time financial assistance to clients. Its funds are used to cover flexible goods and services and items that are not covered by insurance or paid for by any other mean. The fund can be used to complement the care provided by the relative caregiver or to assist in an emergency situation. And then here are a couple more examples of what the ILGRG, assistance funds could be used for. Common assistance would be unpaid bills like rent or utilities. Again, we can help with day program fees through this grant as well. That respite care that I was talking about can also be used to help with medical or other healthcare costs that aren't covered by insurance. Outside of this list, the funds can be essentially used for anything that could be argued as being supportive to that relative and to that person receiving care. Our funded partners have used it to buy things like beds, if that's what's needed, clothing, if that's needed. Can also be used for adaptive supplies needed to help support someone living with a disability. And then this program has a $500 expenditure cap per client. However, the expenditure cap is not completely final. It's really just our guidance that we give our funded partners. Waivers could be submitted to have some additional assistance. And those are approved on a case-by-case basis. Like, for example, if a relative is caring for multiple children or multiple people with disabilities, then likely they would need more than $500 worth of assistance. And then I just want to add that in terms of adaptive equipment, day program fees, and transportation, this grant can assist with things that are not covered by insurance or other community programs. I think I may have talked about this on a few other slides, but most commonly our funded partners end up using this to help with things like grab bars ramps, incontinence supplies, or other items that insurance is not covering or insurance is denying.
Abby, can I jump in with a question?
Yeah.
So let me give you a scenario and see if I'm understanding this right. So I'm imagining myself 15 years down the road. I'm no longer active in supervising the services and the care that my son receives through AID. Instead, my daughter is responsible for that, and she is in her 40s at that time. Is she eligible to apply for funds from this service, for example, to pay for dental bills for her brother?
Correct. Yeah.
Okay. All right.
Mhm.
This is a fabulous program, folks, then.
Yeah.
Wow. Wow.
And then I think I'm handing it back to Leslie at this point. She's going to talk about where we're going to get started. Oh, you're muted, Leslie.
So Abby, I'm wondering if you could just stop sharing the screen for a second. I'm going to share mine and show them the website really quick where they can find resources, because that's really where I want to take them. Okay, so just really quickly for a couple slides. Here's AgeGuide's website. I really wanted you to see it's ageguide.org. I was going to put it in the chat box, but you don't have that for these meetings. So it's really easy to remember. AgeGuide.org is our website address. Then you see down here at the bottom of the screen is TrueAlta. So that's where you would sign up your name, and they want to know your name and county and just a little bit of information. We take, again, this is paid for not by our people that use the service, but by federal dollars. And so we have to report how many folks are in there and, just to keep the funding going. So that's why we need a little information, but not much. So then you'll see right here is services and supports. So you can scroll down. There's caregiver services, which we've been spending a lot of time talking about this evening. And then remember, just a few minutes ago, Abby was talking about the tailored care referral services. And here is a little self-assessment questionnaire that you can take. And then that's how you can get connected with your caregiver service provider in whatever county that you live in. You complete the questionnaire and asks you some questions about yourself. I will say that, and Abby, you've probably heard the same thing. This questionnaire and the assessment that follows sometimes feels like a breath of fresh air for a caregiver, because oftentimes, you probably will all agree with this, is that you hear often about how is your loved one doing, how is that person doing, but oftentimes people don't ask how the caregiver is doing, who's doing that 24/7 support of their loved one. So this just really narrows in on the care needs of the caregiver and provides, based on the answers that are provided through this assessment process, provides the resources that, based on the responses, would be something that would help. A few ideas of things that might help people with their burden, their caregiver burden. So, and again, all this is joining for free. So that's caregiver services. But then I wanted to show you, now I'm going to get out of the caregiver services because I want to show you the resources. So where do I go to find out for the county that I live in, where my resources are? So you go to the county resource sheets page by county. And the great thing about this is it's in multiple languages that are primarily spoken in each county. So if you're in DuPage County, English is always the first one. And then there's Spanish and all the different languages that are primarily spoken. So let's just open Kane County. And all the sheets look like this. What I love about these sheets is that it tells you, if you call senior services, for example, these are the different services that they provide. And it gives you a definition so that oh, this sounds like something that I would be interested in. So when you call them, you can say that you're interested in the health insurance program, the senior health insurance program, or whatever it is, or you'd like to learn more about friendly visiting and friendly phone calls. And it's all, like I said, with little definitions there, so you feel like you're calling the right places. And then here's Kane Senior Council. That's the community dining and home delivered meals we discussed. And Prairie State Legal Services. And one of our community dining sites is Shilin, so they do Chinese meals at that location. So you can call them and learn about that. So I just wanted you to see what if we were with you tonight, we would be handing these sheets out to you. But I wanted you to see how you can navigate the website pretty easily to get the resources that you need. So I'll stop sharing my screen now. Thank you, Abby. Okay,
Give
we'll
me
just
just a
go.
second. I think I gotta.
Sure. I pulled a fast one on you. Sorry
No,
about that.
that's okay. That's okay. It was actually great. I think that was great. Okay. You want me to start here?
So I would just say this is great to have this information, but we told you just go to AgeGuide. We'll get you anywhere you need to go from there. We'll connect you with and so that's just what you could remember. And then AgeGuide has a podcast, and it's been going on for a long time. We have had over 8,000 listens. Every topic pertains to people that are just things that you would need to know about. You can listen to them from wherever you get your podcasts. The most recent one was an LGBTQIA aging experience with Billy Rogers and Golden Rainbows of Southern Illinois. And then we've also had Breaking the Silence around mental health and aging. And a lot of these folks that are talking on these podcasts are just really legendary experts in aging across we have national experts that come and speak and everything. And all different topics. So there's something for everyone there. So I highly encourage you to check it out. And you can get to that on our website as well. Next slide, please. And then every year, well, this will be our 5th annual Aging Summit that AgeGuide does. We have it at the NIU Naperville campus. This year's Aging Summit is going to focus on advancing livable communities. So we're talking about livable communities for all ages. We're talking about age-friendly communities, but we recognize that if it's a community that's age-friendly, it's also disability-friendly. It's also, mom with small children friendly. And we have Bill Armbruster from National ARP coming to speak. We also have our very own Lori Baker coming to speak about the missing middle. It's a great day, and it's just this year's we're especially interested in this year's topic and all the people that are coming to speak. So if you're interested in learning more about that, I would encourage you to next slide. Connect with us from our e-newsletter. Also follow us on Facebook, Twitter, LinkedIn. Mostly, we're not really on Twitter that much, but Facebook and LinkedIn, you can get to us. And we hope that you will come to us with any of your questions, if you have any, and we will get you the answers and put you and connect you with those people that can also provide the direct services. So that's it with us. With this, can we answer any questions for you today?
So this is Jim. One of the questions that my wife and I are beginning to think about is, what does our housing situation look like over our senior years? Because we currently live in a regular neighborhood home. My wife has a number of chronic conditions that make the 2 levels difficult, but we don't want to move, 3 times in the next 15 years. Are there webinars or information available that can help someone in our situation begin to think about, because now we know, our son receives services full-time through AID, so we know that we are located in this Elgin area for the remainder of our lives. So anyway, are there those kinds of webinars or in-person seminars that are available on housing options?
Great question. Age guides, when I was talking about Older American Act services, unfortunately, housing isn't one of the services we're funded to provide, but what our Older American Act services do provide is funding for home modifications. Like we were talking about, there's flexible community dollars. There's falls prevention. So when somebody comes out to your house to do a comprehensive care assessment, they're looking at your living situation and seeing if you have fall, areas of your house that you could, like, throw rugs. We know that those are can cause falls. We know that falls
Fall
prevention
rescue.
is one of the leading issues for folks winding up in the hospitals, falling. So there's things that we can do as far as where can you find housing to meet your needs as you age. That's a tricky one because we know housing is there's, I would suggest you might want to start looking at housing that's available in your area and then seeing if there's waiting lists. We know that for folks that are looking for subsidized housing, the waiting lists unfortunately are around 3 years. So I would say to people, if that's something that you're interested in, but for a later date, sign up immediately because we know it will take some time before your name would come up. And then those other things that we're talking about, maybe having senior services in case of being an Elgin, come out and take a look at your home and helping you with some home modifications. Abby,
Mhm.
do you have anything to add to that?
I was gonna say, if your goals would be to stay living in the house that you're currently living in, Habitat for Humanity out of Elgin has a really wonderful aging in place program that you could possibly get connected to. I know senior
Mhm.
services would be happy to help get you connected to that. Um, they do a really great job of thoroughly walking through the house and figuring out where grab bars could be placed, where ramps could be placed, those thresholds, and different things like that.
So what I'm really looking for at this point is just guidance on how to think about
Mm.
what my housing looks like as I age. And I've talked to realtors in the area. They don't have a good sense of it. And I was hoping that someone had a webinar
Mm.
on these are how you can think about your housing options as I'm not wed to living in this home. I know I'm going to move at some point. I just don't know what my options are within a really localized area. And,
I
I,
think
and now I understand you guys don't provide those services, but where could I find that information that would sort of provide me counseling?
Yes. I,
I was gonna say, I think options counseling might be a good opportunity for you as well.
Mhm.
Because you can let them know ahead of time, ahead of your options counseling appointment, that what you're really looking at is what your different housing options are going to be within the Elgin area. And then they can look at that with you, look at that in terms of your income and where might be a good place for you to get started and to get on some wait lists.
But
Okay,
you make
that's
very,
good advice.
I'm sorry, Jim, you make a very good point that sometimes it's just if I'm going to age in place, what do need to do to retrofit my home for that?
Mhm.
And is there some of it is lighting. I mean, we hear about that all the time. I was actually on a webinar. It was aging related. It wasn't, something in the public, but just about how important lighting is in your home and how, as we age, it becomes harder to see. Just having the lighting on your stairs, going upstairs to in the evenings, so that it's always lit, lights in your hallway, where your plugs are in your hallway as you're going from room to room, making sure that you've got lighting, just low lighting. Um, and then in the bathroom, just when you open the door, you've got a light that automatically comes on, like a little night light that automatically comes on when you walk in the room. There's some for the toilet seats and everything. Sometimes it's hard in the middle of the night, so there's a lot. That's the one that I couldn't believe, and it's true. There's so much conversation around just lighting in your house for falls prevention and to make people feel comfortable. Because I don't know, as we age, we just seem to get up more in the middle of the night, and it's just good to keep it in mind.
Who else has questions out there? These are the experts on questions related to aging, which we are all in that boat.
Yes, it beats the alternative, right? We're all aging.
I don't have any questions. This is Julie, but I already signed up, so I'm gonna go into the podcasts and check those out. And yeah, I mean it's good because I do have a child with disability. That's why I'm associated with AID, but I also am dealing with a 90-year-old mother with severe, depending on the day, how severe dementia. So I'm kind of, yeah. So I'm definitely the caregiver here. So yeah, I'm looking for any help.
And we also offer caregiver support to individuals providing care to older adults as well. So we kind of like tailored this presentation a little bit more specific to caregivers providing care to individuals with disabilities, but our caregiver specialists out in the communities are also experts in senior aging resources as well.
Yeah, I saw that on the website. So yes,
Yeah.
Right.
yeah, I'm a dual caring, I
Yeah.
guess.
Yeah.
Yeah.
And Julie, if you do not need to, your mother does not need to have a dementia diagnosis either. I mean, they're not asking for that. So for the assistance,
Okay.
there's specific assistance for people with Alzheimer's disease and related dementia. So that's additional assistance that's available, but you don't have to present like a doctor's order that says that. You just
Okay. All right.
So-
Thank you.
should have.
Are there
And
other
Carol-
questions out there?
Carol, you're here, right, Carol? Yeah, I think you're trying to answer. Carol
You're
lives
muted.
in, yeah. Carol lives in Michigan, so can you give her advice on how to access similar services where she lives?
Sure.
I
Carol,
also, oh, go ahead, Leslie.
go ahead. Go ahead. I'll look it up.
I wanted to just really quickly say that the services are based on where your care recipient lives. So if your care recipient lives within that 8-county region that we were talking about, then you, even if you're a caregiver in Michigan, would be eligible to receive those types of supports. But I think Leslie was going to find maybe the area agency on aging list for Michigan.
Michigan. Yes. Area agency. Well, I was wondering if you could tell me what, I mean, there's several area agencies in Michigan, kind of similar to AgeGuide's area. We have 13 here. So if I knew, could you give me an area? I have St. Joseph, Grand Rapids, Traverse City, Lansing.
Lansing.
Oh, Lansing. Okay. So the phone number for the Lansing area agency is 517-886-1029. And they open every day at 8 a.m. Monday through Friday.
Is this called the Office on Aging?
Called the Area Agency on Aging.
Area Agency on Aging. Okay. Yes, we do have in our Tri-County area, we have the Tri-County Office on Aging, and they've been very helpful as far as when people start to turn 65 and the services that are available there and helping you.
I'm so sorry to interrupt you. Are you talking about the Tri-County Office on Aging? That's the number you should call them, the 800-405-9141.
Yeah.
Yep, that's the one.
They've been very helpful and things that maybe they don't know about or don't deal, they can send you to another resource that'll direct you again. And so I found that to be very helpful when my husband and I were turning 65 and we didn't know, okay, now where do we go? But they even help us assist in getting the best supplemental medical insurance coverage.
And they're doing their job for you, Carol. That's who I would stick with. Good for you for finding them.
Thank you.
Any other questions out there that we want to ask?
I do have a question. I have a cousin that's in Illinois, and she has a handicapped daughter that lives at home, has a part-time kind of job. I think she can do a little tech stuff. She's been asking me about services and things because, as I said, my cousin's aging and her daughter's I think she's in her mid to late 20s now. Um, Now, would they be able to contact you guys to get resources? Because I know that she seems to feel that she's getting very limited help on this. And I've taken down the information I could get tonight on the Age Guide. Sounds like it's a great resource for her to get on. Plus, I was going to ask her to go ahead and watch this this particular meeting tonight. I thought she can take good notes here. But is that, would that be available that she could just go on ageguide.org and she'd, a lot of doors could open to her, or a lot of information?
Yeah, and then if she gets in contact with us and she doesn't happen to be within those 8 counties that we service,
She's
then
there.
she's there. Okay, perfect. Then yeah, she just would need to get in contact with us, look over our website and see what kind of services might help her out.
Good, because she has never mentioned this to me before, and she's been asking me like AID information. I go, well, and her daughter is not in a program like at present. She lives at home, but like I said, she can do some kind of computer work or something a couple hours a day or whatever. But other than that, she has other disabilities. So this might be because she lives at home, but those things are limited. How long will that happen? Because my cousin's younger than me, but not a whole lot. So anyway, okay, well, that's good. I'm glad I'll be able to pass this along. Thank
Yeah,
you so
definitely.
much.
For anyone that joined a little later, we will be posting this recording as well as the PowerPoint on the website and sending it to Jim to send out to if you missed that note in the beginning.
Abby, how does Age Guide work with, like, I'm thinking of some parents I know who are in their 70s, let's say. They have children with significant disabilities, but they're still living at home. And they seem resistant in some ways to seeking, out of home options. Is that where Age Guide counseling could that be a resource for them, that's separate from the sort of the independent service coordinator programs that Illinois offers on the disability side?
Yeah, I would say either between doing something like that T-care assessment where that parent has the space to have the conversation about the care needs that are happening and how they're handling that as a caregiver,
Mhm.
would be a good place to start, just so that that case manager is able to talk with them more in depth about the services and say, like, you pointed this out, this could really be helpful for you. And then on top of that, the caregiver counseling aspect, where they could have one-on-one counseling sessions to maybe build some type of long-term care plan goals and what things are going to look like.
Yeah, good. Thank you. That's really helpful. So now I know who to refer people to. Thank
Yeah.
you.
Just want to add, sometimes people can't leave their home to go to counseling, and there are, of course, there's online counseling as well as in person, just so for those of you that didn't know that.
There is, yeah, and I know even specifically in Kane County, I'm not sure exactly about all of our other counties, but I know in Kane and Kendall counties, the caregiver counselors there offer sessions over the phone too. So even if someone's not comfortable using a computer, logging in to do that kind of telehealth, they'll do counseling sessions over the phone.
Fabulous that you guys are covering the waterfront.
We're trying.
Yeah, that's good. Any other questions? Well, I want to thank you guys for being here tonight. And, this is a really good set of information. Even if, we don't use it today, we will need it next year and the year after. So thank you so much for providing us with some resources. So thank you.
Thank
Well, it's
you.
been our pleasure.
Yeah,
Thank
thank
you.
you so much for having us.
Thank you all so much. And thank
Thank
everyone
you.
for the great questions.
All right.
All
All right,
right.
Thank
good
you,
night.
Courtney, for hosting this. And
Yeah, my pleasure.
let me give the announcement. Next month is our August picnic, so you will get a notice soon from me. That's one of our in-person gatherings in Aurora. So I hope to see all the families there next month. So thanks again to our presenters and Courtney and to all of you who showed up.
Jim, do you have a date on that in August?
It's the fourth Thursday.
So
Yeah,
that
we're
will
going to
be the 27th.
teletransport you down here, Carol.
Well, actually, I'm planning a trip in August to Illinois again. So I thought I'll just make sure if I can get it that day. So
Yeah, the 27th.
27. Thank you.
Yep, you bet. All right, everybody, be safe.
All right, take care. Thank
Thank
you.
you.
Thank you very
Thank you.
much.
Thank you.
Bye-bye.